Why is it that many of the patients who goes to the hospital still come out with very poor treatment outcome, even though they were diagnosed very early? Why is it that a stage 1 or stage 2 breast cancer still have a very poor treatment outcome, even when she sticks to the oncologist's treatment plan? Why? And we realize that there are multiple reasons to that. One of the reasons is access to essential medicine. In Nigeria, we don't have access to essential medicine. But if you think about it, access is a macro issue. It's not something one nonprofit can solve. It needs government intervention and a lot of collaboration. Number 2 is clinical trial. Many people who cannot, there are many medicines that are used in Africa that were never tested, field tested with Africans.
Okay.
Yeah. Then number 3 is the healthcare workers. Some of them do not have the appropriate skills to really provide the appropriate treatment to the patient.
Yeah.
Other reasons.
Yeah.
And among other reasons. So we looked at these 3 core reasons and we asked ourselves, the first reason, we can't deal with it, access to medicine. We can only continue to talk, but we cannot coordinate that. We're a nonprofit. The second reason, which has to do with clinical trial, we do not have the resources at this moment to really get all the lab work and get all the collaborations and get all the funding from NIH and stuff like that to see how we can do clinical trial in this country, right?
Of course.
So we looked at the third one, which is about ensuring that the limited clinical oncologists that we have in the country, that they have the right knowledge and updated knowledge to provide the best care.
Yeah.
That is how we founded Upgrade Oncology in 2018.
Okay.
What we did with Upgrade Oncology is to work with the US Embassy in Nigeria and to work with the US Department of State. The US Department of State have what they call the Fulbright Specialist Program. The Fulbright Specialist Program is where US citizens are requested to really register on the US Department of State roster as experts. Okay. And they can be provided with a grant to travel to low and medium income countries to provide their skills and exchange the US knowledge with the rest of the world. That is what the Fulbright Specialist Program is about. Okay. So I was really honored to have been one of the US government alumnus from one of the exchange program known as International Visitor Leadership Program. So I tapped into the Fulbright Specialist Program, contacted the embassy, and the embassy worked with us to bring in 2 US medical oncologists through the Fulbright program to Nigeria to provide the training to the Nigerian oncologists.
Brilliant. Sounds like a great program. What type of training was given?
Yeah, so the training, the Upgrade Oncology training in 2018 was primarily focused on medical oncology. In Nigeria, the way our oncology care is designed is slightly different. We do not have a medical oncology, right? So what you have is sort of clinical oncologists who are more like they are radiation oncologists and also provide chemotherapy. Okay. Yeah, so we brought the 2 medical oncologists. They spent about 15 days in Nigeria providing didactic, training to the Nigerian clinical oncologists.
Okay.
And, yeah, and it was really, really very, very impactful.
Okay, so it was more about training clinical oncologists, more about medical oncology. Is that right?
Exactly. Yeah.
Okay. Excellent. And what were the outcomes? Like, well, you mentioned there was it was very impactful. Can you tell us about some of the changes that came as a result?
Oh yeah, that we were really excited. We're so super excited that it was really remarkable in the sense that from our pre and post test that we had, we can really see, about 20% increase in knowledge, from
Excellent.
what they had previously. Like, I mean, the pre-test that we had, in the core items of the tests, some of the the oncologists were scoring like 50, and then after the training, they were scoring about 78 on the same item. So
Wow.
that was really impressive, And then afterward, another very interesting thing that also happened was that we saw a partnership between the medical oncologists that came from the US with the Nigerian oncologists. They began to partner, to do research together, to collaborate, to do something, together. And that's really what the exchange program is about, exchanging knowledge and connecting people to build partnership. Because without partnership, honestly, we cannot truly have a global, oncology care.
Of course.
Yeah.
Could you tell us more about the type of research collaborations that came out of the program?
Yeah, so currently now, there's a paper that has just been submitted to the ASCO GGO journal. That's the Journal of Global Oncology. The paper was first presented, that's the paper about the outcome was first presented at the European Society of Medical Oncology meeting in Spain I think it was in 2019. I think it was in 2019, yeah. And then so the full paper is now being worked on, to get it published. That's one. And also secondly, it was because of the impressive outcome of the Upgrade Oncology of 2018 that resulted to the additional funding that we got to implement Upgrade Oncology again in 2021.
Excellent. What's the plan in 2021? Is there any changes or?
Oh yeah, there's a lot of changes. We have learned a lot from some of the mistakes we made in the past, and also have seen ways to really sort of upgrade that. So what we're doing in this 2021 now is we are branching away from medical oncology or clinical oncology. We are now tilting to oncology pharmacy.
Okay.
Yeah, so I think it's supposed to really be a situation whereby the oncologist prescribe the chemotherapy, and then the oncology pharmacist does the reconstruction, right? And then, the nurses does the administration. Yeah, so there is a very strong gap in that part of reconstruction. In some of the facilities in the country, we have the doctors who does the reconstruction.
Okay.
So we want to provide that kind of theoretical and clinical practical training, to this, oncology pharmacists.